Hi there. So today's topic is choosing a subspecialty after residency. As you go through the residency interviews, one of the questions that will be frequently asked is what are your plans after residency and if you are interested in a subspecialty fellowship. This can be a daunting question as it is challenging to understand the nuances of various subspecialties just after medical school and what your eventual interests will be after residency training. Of course, many physicians choose not to pursue further subspecialty training and instead focus on primary care or hospital medicine. For physicians training in internal medicine and interested in a subspecialty fellowship, for example, there is a vast menu of choices such as cardiology, GI, rheumatology, hematology oncology, among many others. So, given the vast array of potential fellowships, it may be helpful to have a general sense of what your interests before you attend residency interviews so that you can address this question with greater confidence. In our opinion, if you are undecided about subspecialty interest before residency training, it is perfectly fine to acknowledge that and to say that you'd base your eventual decision on your interests and experiences during the first 2 years of your residency training. There are several factors to consider in making a decision about pursuing a fellowship. The most critical factor is your interest in that subspecialty. That is, do you have a passion for that branch of medicine? This passion should be both for clinical practice in that subspecialty as well as research, as most of the fellowships will require that you demonstrate both clinical and research interest. It can be very helpful to do clinical electives or clerkships during medical school to gain experience in that subspecialty and to see if it's a good fit for you. As you rotate through these electives, you should ask yourself whether you're going to be happy doing this for the rest of your life. It is also critical to seek out your experienced mentors in your desired specialties and discuss opportunities and challenges in that specialty and how they foresee the evolution of the field in the next 2 to 3 decades, which will be when you'll be practicing. Also speak to current fellows about their experiences and what makes them choose that specialty. If you are in your internship year and are trying to decide on a specialty choice, you may want to rotate through these specialties during your elective months and seek the advice of your faculty and your program director. If you are inclined to choose a specialty that is associated with interventional procedures such as cardiology or GI, you should assess whether they'll be a good fit for you. Other factors to consider are the length of various fellowships. Most specialties require a 3-year fellowship after residency. Many specialties also offer additional 1 to 2 year advanced training following the completion of the regular fellowship. For example, to be trained as a therapeutic GI endoscopist, you would complete 3 years of GI fellowship and then an advanced endoscopy fellowship, which can range from 1 to 2 years. Several other factors can influence your eventual decision, such as competitiveness of the fellowship, job prospects, and work-life balance. But your clinical and research interests should be the primary factors for your subspecialty choice. So hopefully you got some ideas about how to decide on the subspecialty post-residency and tackle this interview question. As always, you can subscribe to our channel to get regular updates, send us your questions, visit our website and connect to us on Facebook. Thank you.